Good morning, everyone. Thank you for attending the Healthicity Compliance presentation, 4 Incident Management Tricks that will make you more productive. My name is Justin Larson, and I'll be our facilitator today. A couple of items to mention before we begin. Today's webinar will be about 45 minutes, followed by a Q&A session. Your line is muted, so if you have questions, please send them via the question box, or feel free to email your questions after the presentation. Please note there will not be any CEUs for today's webinar. Also, we will be emailing everyone after the presentation with links to the webinar recording and the presentation slide deck so you can download it. Our presenters today are CJ Wolf and Remo Peshkapia. CJ is a healthcare professional with more than 20 years of experience in hospital revenue cycle management, practice management, compliance, coding, billing, and client services. He has been providing healthcare consulting and solution services to hospitals and physician organizations throughout the country. Remo is a member of the Healthicity implementation team and has more than 20 years of experience in healthcare business services, working primarily in provider relations and accounts receivable management. With that said, I'll turn the time over to our presenters.
Thank you, Justin, and thank you all for joining today. I'm excited to be able to talk about our incident management and some possible solutions, and I appreciate the presence of my colleague Remo, who's an expert in the software solution that we're going to discuss today as well. So let's get started. Recall that 3 weeks ago we did a webinar on incident management, and what we're going to talk about today is how you can use software to help in incident management. So we're not going to rehash all of the material from 3 weeks ago. If that's a webinar that you missed and you'd like to view all that information, you can go to our website at healthicity.com/resources, and you can watch the on-demand webinar. But we will review, just to kind of refresh your memory, on some of the key concepts. And let's start with this phrase, or this quote from the OIG. Remember, let's just take a step back and look at compliance programs. What is the whole point of a compliance program? And the OIG reminds us that the whole point is that compliance efforts are designed to establish a culture that promotes prevention, detection, and resolution of instances of conduct that do not conform to laws and regulations. So it's really important to know, obviously we're trying to prevent wrongdoing or missteps, but no organization is perfect. So we're going to have examples where an instance where something went wrong. Where a compliance program can really show its effectiveness is by how well it detects those incidents and how well it does in resolving those incidents. So just as a reminder, these are our 4 major areas of incident management: discovery, investigation, corrective action, and documentation. And what we're going to do today is we're just going to highlight those 4 areas again, just review a little bit from a few weeks ago, but we're really going to spend most of our time focusing on how a tool such as a software application can help you manage this. I've been a compliance officer, and I've done this with paper and pencil. I've done this with spreadsheets. I've done this with paper files and email and all sorts of different applications. And what really excites me, and I am biased, but what really excites me about Compliance Manager, which is the software tool, it's one place where you can manage all of these incidents. It's really designed for a compliance officer. So what we're going to do today is we're going to share an example of an incident, and then we're going to use that example to walk you through those 4 major steps. And it's going to be a HIPAA example. And I wanted to throw up just that, we all know that HIPAA breaches and HIPAA incidents are real life examples. And here's one that was relatively recent. This was a orthopedic clinic, and they settled for $750,000, mainly because they had a breach and they did not have a business associate agreement assigned with an entity that they turned over PHI to. Now, in this example, there was quite a few individuals affected, over 17,000. That's not the example we're necessarily going to use today, but it's in this realm of HIPAA. So I just wanted to throw that up there. So let's talk about the first main pillar of incident management, which is discovery. And just to kind of review what we talked about a few weeks ago, key points of discovery. It's important that we recognize and document, is the incident being reported internally versus externally? Is it anonymously reported, or is the reporter known? Is it proactive versus reactive? And what I mean by this is many times we feel like we need to sit in our compliance offices and wait for somebody to report an incident. And that happens a lot, right? We want to make sure the communication is available, hotlines, those sorts of things. But you can also be proactive, and two examples are exit interviews and annual employee evaluations. So when an employee is leaving your organization, it's a perfect time to ask, are you aware of any compliance issues? And that proactive incident discovery is a really good practice. The other is when most organizations have an annual employee review with their HR system, and managers obviously rate the employees and their performance. That's an excellent time to ask questions such as, are you aware of any compliance issues? So those are two examples of proactive. Also, it's really important to triage these. And the reason I'm highlighting some of these is Raimo's going to show us in a moment some of the functionality of Compliance Manager that allows us to accomplish some of these things. Also, it's important to, in some instances, it's important to document and to highlight and to mark an incident as something needing attorney-client privilege. Okay, that's not all of our incidents, but some. And we're going to talk about, too, how software can help you both provide updates up and down. And what I mean by that is you want to be able to report metrics upwards, maybe to your compliance committee or to a board of directors, but also down. What I mean by down is to the individuals who are reporting the incidents. That's really important. And then something that's relatively come to the forefront more recently is this ticking clock idea, having some sort of timestamp and knowing when an incident was reported so that you can demonstrate you were pretty quick in being able to address that incident. So what we're going to have Raimo do at this point is we're going to show you the software, and he's going to show you what it would be like if you had access to the software, how you could report an incident, and how simple that is. Raimo, would you mind doing that for us?
Sure. So what we're looking at here is the Compliance Manager dashboard. I know that there's an incident reported on the dashboard because of the incident card. I see I've got two here that are unresolved. Any of your staff or anybody in your organization that has access to Compliance Manager is able to report an incident through the system. For that, I'll click on the Reported Incident card and be taken into the workflow. So there are three required fields. The reporter will title the incident and include a description. The other fields are optional that you see here. The reporter does have the ability to report anonymously if they choose. They can also attach documents, and then they'll simply submit the incident.
Great, thank you, Raimo. So that's pretty straightforward. Now, many of you compliance officers know that having something like this would be very helpful if you had trained your staff and your employees to be able to report an incident directly. What a time saver. They've documented, they've started the initial documentation. We also know that many times that's not how incidents come in, and that's okay. You can get them through a hotline. I used to get them frequently as I'm walking down the hall, or I leave a meeting and the department chairman of the surgery department pulls me aside and says, I've got concerns about X, Y, Z. And so I can go in and enter an incident into the system. And it's essentially the same process. Now what we'd like to show you is what does the incident manager see when an incident has when an incident has been reported. Now, one quick comment on this before I let Raimo show us that. In some smaller compliance departments, it's probably just going to be the chief compliance officer that will manage all incidents, right? All those reported incidents will come to the compliance officer, and he or she will determine how it's going to be handled. But in some larger organizations that I've served in, we often had an incident manager, and the compliance officer was kind of overseeing that individual. And what's great about Compliance Manager, the software, is you can delegate that authority or that responsibility to an incident manager. So now what we're going to do is show you, Raimo, would you show us what it looks like when an incident's been reported and what the incident manager sees when they sign into the system.
Sure. So we're now looking at the incident dashboard. I've got cards represented here. I saw on the main dashboard that we had two incidents that were reported. I see I've got one here that's pending assignment, meaning that the incident's been reported, but no action's been taken yet. The system allows 48 hours for the incident manager to address the incident before it becomes overdue. I'll go into the detail of that reported incident. So as the incident manager here, I can view how the incident was reported.
Excellent. And we're going to show you some of the functionality of this in our next example. We just wanted to show you what it would look like on the previous view, Ramo, with the cards of what the incident manager sees. And Ramo, if you could go back to the cards just for a moment. One of the things that I really love about Compliance Manager is it does, as Ramo mentioned, if you haven't responded to a pending incident, then it will move over to the overdue incidents. And Ramo, that's that second card there. Is that correct?
Correct.
And so it's a great dashboard. It helps you see and manage. Because sometimes you get many incidents reported all at once, and then you have a lull for a while. It's a great way to kind of manage that. So let's go now to our slides, and we'll go to the next major pillar or step in incident management, which is the investigation stage. So we'll go on to our investigation, which is our second major aspect of incident management. And let me just share with you a quick thought from the OIG on the concept of investigation. So they say, depending on the nature of the alleged violation, an internal investigation will probably include interviews and a review of relevant documents. Some should consider engaging outside counsel, auditors, or healthcare experts to assist in an investigation. What I love about Compliance Manager is that you're allowed to own the investigation yourself if you want, if you're a small shop and you need to. You're also able to assign it out, and Raymond's going to show us this in a moment, but you're able to assign it out internally. But let's say your organization doesn't have the bandwidth, and let's say your compliance department doesn't have the resources on that day or in that month to deal with something. You can give access to, let's say you engage an external counsel or an external auditor or an external healthcare expert. You can give them temporary access to Compliance Manager so that they can help you manage the investigation if the incident rises to the level of needing an investigation. Sometimes, and many times actually, incidents, after you do an initial kind of quick and dirty asking a few questions, you find out this is not something that's going to require an investigation, and we're going to show you in a moment how you can close that immediately. One more thought on investigations. They have to be determined on a case-by-case basis. And so there's not really, a lot of the questions that we receive here at Healthicity have to do with, what am I supposed to do next? What am I supposed to do next? And my answer is, I know people hate it, is it depends. Because it really is a case-by-case type of situation. Another very important part of investigation is that you're identifying root causes. And this is necessary for the next step, or our third area, which is corrective action. So as an investigator is interviewing people or running reports or doing some sort of audit or investigation, and they identify root causes, it's important that you document those root causes, because they often lead very seamlessly into the corrective action itself. So why don't we, Ramo, go to the demo, and we'll show you a little bit about how an incident, once it's been reviewed by the incident manager, could be assigned as a investigation. And what we've done to kind of help speed things along, and you don't watch us type, is we've taken an incident and we've matured it through the process. So you're going to see all of those fields filled in, but we're going to identify some of those key aspects. So Ramo, when you're ready.
Sure. So as the incident manager, I can edit the reported incident in terms of categories. So I see here I'm in the edit mode. What I cannot change, of course, are the title and the description. But as I scroll down here, I can see the other fields available. The reported department was neurology. Perhaps that's correct. I can leave that as is. The reported category is HIPAA, but then I have the option of adding a subcategory.
And Raymond, if I could jump in here, what I really like about that is as you click on the subcategory again, if the subcategory is not there, you can always add a subcategory. And so Compliance Manager is very flexible in that regard. It helps you manage the program the way you want to manage it. And then another key area is right below here in the source. You notice from my discovery slide that I shared, it's really important that you document, is the incident being reported by somebody internal or external? And as Raymond pointed out, the incident manager has the ability to change these fields if the original person who reported the incident got it wrong. Okay. The next field there is suspected cause. Frequently, what I've experienced as incidents are documented is there's already been a bunch of phone calls or emails or hallway conversations about it, and so you already start to get a suspected cause. And so this is a great place to kind of jot down those notes and those ideas and those thoughts. Here, the next field is immediate resolution, and this is what I was referring to previously, when sometimes you know relatively soon that the incident is not going to require an investigation. So you can talk about, our immediate resolution was this, we did X, Y, and Z, and we're able to eventually close this. It's also important, as Raymond pointed out, that you can see if it was reported anonymously or not. In this incident, it was not anonymous, and so you can see who the reporter is. And then you'll notice a risk area. What I like about this is that there were weeks when I was getting multiple incidents in some of my larger organizations that I worked for, and I'd like to just kind of mentally make note, and now you could actually do it here. You could describe, is this critical? Is it severe? Is it moderate? Is it low? Helps you prioritize things. And man, I wish I would have had something like this when I was a compliance officer, because I was just jotting these things down in my email or a calendar and trying to prioritize things. Here, it lets me keep it clean, it lets me return to it, and lets me reassign things as my priorities change. And then, as Raymond pointed out, you have documents as well. And you can see here in the documents, we're going to address what, so I'm not going to go into them too much right now. This has reference to some of our root causes and corrective actions, so we can return to this main area there. Very good. So now let's go back to our slides and talk about the third major step in incident management, which is corrective action. So it's important, again, let's just give you some themes from the authorities. The OIG said, detected but uncorrected misconduct can seriously endanger the mission, reputation, and legal status of the organization. This may go without saying, but I need to say it anyway because we still see examples where people identify an issue and they choose not to correct it. It's better maybe it's better not to have ever identified it in the first place, because what's more damning than, oh, I noticed this billing incident, or I noticed this HIPAA incident, and oh yeah, we did it wrong, but let's just move on. So it's really, really essential to be able to show that you've corrected any misconduct. And as we all know, the federal sentencing guidelines are kind of the foundation in the Bible of where the 7 elements of an effective compliance program originated. And what they say is the organization shall take reasonable steps to respond appropriately, including making any necessary modifications to the organization's compliance and ethics program. We're going to show you in a moment how Compliance Manager even allows you to demonstrate when you need to adjust your compliance program. And that actually is a strength. It's not a weakness. Over time, you want to be able to demonstrate that your compliance program is serious enough that you let it evolve, you let it mature. And so Compliance Manager helps you demonstrate that when you actually do that in your program. So before we go on to documentation, we're going to go back to our demonstration, and we're going to talk a little bit about the corrective actions. So I'm going to have Ramo demonstrate how Compliance Manager aids you in the corrective action functions.
Right, so the next section here we're looking at is the incident assignment. So here we've assigned the incident to somebody in our organization. I've indicated investigation due date, comments for that investigator, and then when you assign something for investigation that ultimately will lead to your corrective actions, you also name a final approver of that investigation. The next section you see here is the results of the investigation. So when you assign a investigation task, the individual will be required to complete the investigation results in order to complete that task. Once they've done that, as the incident manager, you'll be able to see the detail as we see here. So here I've got investigation results as well as in the immediate corrective action section, the recommended corrective actions.
Excellent. And what's really important here is, and what I love about this is, when I have had I had 4 managers and we had 2 or 3 investigators on one team, this was a great way to track the progress. So you have the compliance best practices, but then you just have the run-of-the-mill day-to-day managing a compliance program and managing people, which is not unique to compliance, right? But what the flow allows for you to do here is it allows you to assign things out to individuals in your department, if you have a large compliance department, or maybe you don't. Maybe you need to assign them out to the billing department, or to the accounting department, or to the HR department. And this still allows you to interact with people from other departments in the organization and then track all of that important information and what steps are being done, what are the findings, and those sorts of things. And so you can see here that as our investigator proceeded with this investigation, she found some root causes. And you can see that insufficient training was one of the root causes, human error. And we identified in this scenario that there was a gap in the policy, the existing policy or procedure. Now, when you've identified root causes, you can almost in the same breath name what the corrective actions will be. That's why root cause analysis is a very important part of the investigation. And again, we focused and spoke a lot about this in the webinar a few weeks ago, so go back to that if you want more details on root cause analysis. But you can see from this, if somebody had, if there was a gap in a policy, what is obviously one of the corrective actions? Well, you would correct the policy. And one of the great things that we don't have time to show you today, but one of the modules in Compliance Manager is a policy management system, more or less. It allows you to reminds you when a policy needs to be updated, and it keeps track of versions of policies and revision dates and those sorts of things. So, but to kind of be quicker here, we're just showing you number 2, that in number 2, we updated the policy. Now, when you update a policy, what do you need to do? You need to have people read it. Well, let's not just, you can't just say, oh, yeah, our staff read it. What Compliance Manager does is it allows you to attach that policy to an action called an attestation. And you can see that from our corrective action section, item number 1 is an attestation, where you send out the updated HIPAA policy to the required individuals, and they're required to attest to that. And so, Ramo, if you would, can we go to the attestation just to show the participants what an attestation might look like?
Sure. So when I name something like an attestation as a corrective action, I'll be able to create it directly from the incident detail page. Once I've done that, it's linked, and I can get to the detail of that attestation by clicking on the title. And now I'm into the attestation details here.
Excellent. And so you can see we named this one pretty straightforward, attestation to updated HIPAA policy. But what the recipients will receive is that title as well as instructions. And so what we thought was important in this scenario is please read the updated policy and attest to your understanding and agreement to follow the policy. Your attestation will be recorded to demonstrate city clinics' compliance with HIPAA regulations. So it's a really straightforward type of attestation. And Ramo, the recipient of this would receive in an email, is that correct?
Correct.
And also as a task.
Yes. What they'll get when you assign something like an attestation is an email notifying them that they have the task of an attestation pending in Compliance Manager, prompting them to log into Compliance Manager to see the detail of it.
Perfect. And you can see for recording purposes and documentation purposes, you can see that there's an attached document, which is our actual policy, the completed count, how many have completed this attestation and who has not. And as we scroll down, you can see some of the attestation responses. So we have our 7 employees here. Employees are allowed to make comments. Here we received a positive comment. As you know, in the compliance field, you'll probably receive many negative comments as well, or maybe questions and that just honestly don't understand. But on the far right, you can see the column of the completion date as well. And so this is a great tool to demonstrate to either a board or a compliance committee, or heaven forbid, an external agency, if you're called on something, that you took appropriate actions as corrective action number 1, which was our attestation of an updated policy. So Raymond, let's go back and show them some of the other corrective action features.
Sure. So to get back, I've got a link back to the incident here, and I'm back into the incident detail page. And I'm going to scroll down back to the corrective actions.
Excellent. So let's kind of play our scenario out a little bit more. We felt that updating the policy was step 1, getting the attestation was step 2, but it was also essential not just to have people read the policy. We wanted to go a step further and make sure that we had some training on this. Now, what I love about Compliance Manager is there's a whole training module here. As we know, that's one of the 7 elements, training and education. And rather than go through all that, we don't have time to do that today. We're going to show you and tell you that we assigned a training out to the various individuals, and there's a training report that can be run, and we've attached that training report. So Ramo, show us where that documentation can be held.
Sure. So we've attached it to the incident detail page, and so under the document section, I see all documents attached, including that course report. I'll open that up, show you what one of the reports looks like from the Learning Center. So here I've got a representation of the course and who's been assigned to it. I've got the status of their completion here, and ultimately the score. Each one of our training courses have a quiz attached that's available to you, and I see here that each have been completed, and luckily we've got a 100% score for each.
Excellent. And those quizzes can also be changed and updated according to what the user would like the quiz to say. Is that right?
Yes, and in addition to the courses that we provide, you can also upload your own training courses, and we can help you build a quiz in relation to that.
Excellent. So far we've shown you, we'll go back to the incident page. There we are. We've shown you 3 corrective actions. Now those are going to also be very outward corrective actions, meaning if you're an employee in that department that had this issue, you're going to see those actions being taken. Now we've thrown in another action because this is something that I like to do. Just because you've updated a policy, you've done training, you've got attestations, doesn't mean that people are going to remember this in 3 months, okay? So kind of the trust but verify type of rule. We've done everything we could to this point in real time, but you can also schedule audits. So let's say it's an issue that you've had some history on, and let's say in this scenario, the department administrator who made this mistake and emailed out this PHI, let's say this is their 2nd or 3rd instance of doing something like this. Well, we're getting to the point now where we want to make sure that that behavior is corrected. So we've set up an audit that Compliance Manager will help remind you of when to do the audit. So Ramo, if you would go ahead and click on the audit, we can highlight some of the qualities of that audit. And what I'd like to show here is that title's pretty explanatory, HIPAA audit of neurology department administrator. So you have the department, you have the type, the subtype is a retrospective, meaning I'm going to do this after the fact and go back in time. It's a HIPAA, and what my scope is I want to audit external email correspondence. So because that was part of what the scenario was in this case, is the department administrator erroneously emailed something external to the organization. So if we're wanting to make sure that kind of behavior stops, we can set an objective of identifying any possible emails containing PHI in conflict with our new updated HIPAA policy. And you can see at the bottom that see that we've set this as quarterly. And as Ramo scrolls down, you'll be able to see that who you've assigned the audit to and the created date, as well as when the first, some of the due dates will be. Yeah, there it is. Under the frequency, the due date of 10/31/2016. There are other things in Compliance Manager that we weren't showing you today, but you could include this in an annual work plan if you wanted to. And that it's self-explanatory here. You can see what we're trying to do. But the reason that I wanted to have an audit here is that's one of the key aspects of corrective action. You do everything you can up until today's date, but you also want to look into the future to make sure that that behavior or that error is not going to occur in the future. So Ramo, why don't we go back to the incident, and we'll go back down to the corrective actions, and I believe we've demonstrated all of those corrective actions. Other things that we've included in the document section are notes and disciplinary guidelines, and we're going to now go back to our slides on documentation to address those types of tools. So you've done all this work, right? It sure is a waste if you don't have documentation of all this work. And as I mentioned previously, when I've done this without a system, I've had to rely on email, for example. Let's say I sent out an attestation via email, and so then I go into my sent items folder of my email box, and I try to find all the emails I sent out, and I try to print them off or create them as PDFs and save them on a hard drive. Or you have all these different systems. Let's say HR did the training, and they have the sign-in sheet, and that's in their filing cabinet. And maybe the investigator who did the work no longer works for your department because they're being called on this. You're being asked to produce documentation 4 years later, or maybe it was in their notebook, right? Interview notes in their notebook, and that person no longer has that notebook. So what the OIG expects is a solid system of documentation. They say records of the investigation should contain documentation of the alleged violation, a description of the investigative process, copies of interview notes, and key documents, a log of the witnesses interviewed and the documents reviewed, and then the results of the investigation, and any disciplinary action that needs to be taken, and the corrective action that was implemented. So the next slide here shows just kind of a summary of some of these things. And from our previous webinar, there were additional best practices in the documentation step of incident management. And this is just a summary of some of that. There was one corporate integrity agreement that I read that required the entity to log within 2 business days the incident. So, how are you keeping track of that? Summary of each entry. The persons that are involved in the investigation. Again, some of this is a repeat. Status, corrective action taken, and so forth. So Ramo, let's go back to the demonstration, and we're going to start at the top, and we're going to show you all of the items now that are here essentially at the click of a button. So if you follow the process, and let's say you close out this investigation, let's say it's 2 years later, and the final approver has approved it, and you now just have it all kind of put away in your electronic file. Let's say you get an email or you get a investigative demand of some sort from an enforcement agency. Well, here it is. You don't remember it anymore. Let's say you're now the new compliance officer, and fortunately your organization has kept Compliance Manager as a tool, so it's all right there. You can see here all of the things that we've just covered. There it is, privacy breach, the description, the person involved, and you obviously can add more people here, the status, the categories, the subcategories, the risks. And as we scroll down, you can see this particular incident we did not deem as attorney-client privilege, the created date. So that's an important aspect when you're talking about this 60-day repayment rule, excuse me. You can clearly see how the incident was managed, who it was assigned to, the date it was assigned. There'll be ways to see when it was due and to see if that person maintained that schedule. Okay. You can also have the investigator input their notes, as we've talked about, and final approval. Now, in this case, Raymond, we've left it as final approval is pending because we're still, we're still waiting. But there may be ways for you as the final approver to go in, and can you maybe demonstrate that for a moment under final approver, how they would go in and change something if they needed to in the edit field?
Sure. In excuse me, in the incident detail section.
In where the right there, yes.
Right. So the task that a final approver has is to either accept the investigation by approving it, or they can send it back for additional investigation if that's an option for them. If I go into the edit mode here, I can indicate here my comments and then save and complete that. I do have the option of saving so that I can go back later and maybe put some additional comments in if that's necessary as well. But again, you have the option of either approving it or sending it back for additional investigation.
Excellent, and that's a key way to close the loop, so to speak. So a lot of times in compliance we talk about from reporting to resolution, and to me that's the time frame. You have when was this incident first reported, and what is the current? How long did it take? Did it take you 2 years? If it took you 2 years, you're going to have a hard time demonstrating to authorities that your compliance program has a meaningful action that it's taking, okay? But if you can demonstrate it took you 2 months or 2 weeks, that's very powerful in showing that your compliance program is effective, okay? And as we scroll down, he's showing here that the root causes are documented, our corrective actions, and what I love again about this is you can attach the documents, you can attach the policies, you can attach the investigation notes, so you can see down under the document section that there's the title there of investigation interview notes. There's HIPAA violation disciplinary guidelines. So let's say we took disciplinary action against this person. We can demonstrate to the OIG or to another agency that, yes, we have guidelines and we follow them. And we follow them regardless of whether it's the CEO or a department manager or a frontline employee. The other thing I really like, Ramo, is at the very bottom we show an audit trail. And this is so essential. It shows every person who has been involved in an activity of some sort associated with this incident. And it's time-stamped, right? So you have dates, you have times, and you'll notice on some of these there's pluses. And so additional sub-work, if you will, could be completed. So let's say A. Jones, if you recall, A. Jones was the person who was the final approver of this particular incident and investigation, and what A. Jones did was add a new value of a subcategory of privacy. So that was not included in the original reporting of the incident, but here you have this audit trail, you have all these records of all the steps that were taken in association with this incident. And there it is, it's all in one place. Ramo, do you have any other comments on documentation or anything in regards to the functionality here?
Yeah, two things I think that sort of demonstrate how software can help you with this sort of thing is in Compliance Manager, for things like this document, the HIPAA violation disciplinary guideline, and the document that we attach to the attestation, the policy, Compliance Manager has templates in the system that will provide you those documents. These are templates that contain standard verbiage based on best practice that you can edit, make more maybe specific to your organization. The other thing that I think is really helpful is the automation in the tasks. So for instance, when we created this audit and made this a recurring audit for a quarterly audit, the system's going to automatically remind me if I'm responsible that it's time to perform that audit again. I'm also going to get reminders as the due date becomes closer, and if it does become overdue, I'll get a notification of that as well.
Excellent. So just before we're going to take questions in a moment here, but let me just kind of summarize what we've gone over. So again, our four main steps in the process of incident management are discovery, investigation, corrective action, and documentation. And hopefully you can see from what we've shown you how a software tool like Compliance Manager can really help drive that workflow. It can help you, it can help prompt you, maybe things that you didn't think of that you're going to miss, but definitely it helps keep track of all the documentation. And again, I just repeat, I would have loved to have had something like this because I remember what I used. And many of you are probably using, emails and paper policies, or your policies are housed somewhere else. It's been designed this way to make it easy. So with that said, we're going to open it up for questions. And we invite you to type your questions in. Also, if there are certain questions that we don't get to today, feel free to email me. My email is listed there on the screen. And we would love to be able to try to help you answer some of these questions that you have. And while we're waiting for some of these questions to come in, I'm going to start reviewing some. A lot of you are asking about the slides. Yes, you are going to get the slides. Let me answer this first question. Are you aware, this is interesting, are you aware of an actual scenario when having all this documentation really made a difference? Yeah, it's a good point, right? We emphasize all of this, and maybe we're a bunch of worrywarts thinking about what possibly could happen. Does it ever really happen? Fortunately, it doesn't happen all that often, but when it does, man, you're happy that you have all this. So to answer your question, yes, and I'll give you kind of two thoughts. One, I had a personal experience, and the other is one that is more in the public press about a year or so ago. The first personal experience was an issue with modifier 59. That's a modifier for billing. It's a CPT modifier that allows individuals to, or allows providers to bypass these CCI edits. Well, it became apparent on a routine audit that one department in particular was appending that modifier a bunch of times, and they were bypassing all these edits, and they were getting paid. This is kind of like the unbundling concept that you may have heard of. And so we identified that, and we had to go back and find where's the starting period, okay? And we really followed this process. So we did this process of discovery. We went back, we found out, okay, who was the employee that first started appending this modifier? We had our IT department run reports of frequency of modifier 59 use. So those were on Excel spreadsheets. I had to print those off and put them in a paper file. So all of kind of my source documents, I would print off hard copy, and then we kept these in a file folder. So what we tried to do was keep all of this in a paper system. And this was before tools like this really existed, or at least we didn't know about them. And so we did our best to do that. But it really did come in handy because we were asked once to demonstrate a part of our compliance program, and I was able to go and get that folder and kind of walk somebody through. But wouldn't it be cool to be able to, rather than walk somebody through a paper folder, print off this stuff or put it into a PDF binder, so to speak, and be able to email it, within 20 minutes or 10 minutes or a few minutes of a request from a government authority. They don't have unlimited resources, and they're going to look for low-hanging fruit. And if you're not the low-hanging fruit, then they might move on. One way to demonstrate you're not the low-hanging fruit is to show them you've got all of your stuff in order. And so it really does make a difference. The second one was a more publicly announced type of issue, and it was with Morgan Stanley. I've used this example before in some webinars where the Department of Justice declined to bring any action against Morgan Stanley because they were able to demonstrate that they had done 47 trainings for this individual that had performed the misconduct. They had done training for departments and regions of the world that are susceptible to that risk. So it does make a difference, and it can make a difference. And it's really, a lot of us talk about compliance programs as our insurance policy. A lot of people say, that's why you should pay for a compliance program, CEO. It's your insurance policy. Well, good insurance policies are there when you need it. So that's a really key aspect. So here's a good question. When tasking within Compliance Manager, is it restricted to employees who have been given access? And maybe I think that might be a good question for you, Ramo, if you're comfortable addressing that one.
Yes. So the answer to that is yes. When you go to assign a task, any task in Compliance Manager, you're going to be taken to a list of your employees. You'll be able to select from those individuals, and there's a couple of ways I think the system can help you with that. CJ, you and I talked a little bit about in the past who can be an investigator. If you're able to identify those individuals in your employee list, you can categorize your employees by things like departments, but also position title and position type. So if you identify somebody as an investigator, you can quickly get to that list of individuals very quickly by filtering.
Yeah, great. Good. Thank you, Ramo. There's a few questions here that are kind of all in the same topic about price and what's the cost of Compliance Manager. I request that you contact us because it really depends on kind of the size of the organization and those sorts of things, and we'd be happy to address those questions. Feel free to email me if that's something that's of interest to you. Here's another question, and Ramo, this one might be for you. It asks kind of about the final approver functionality that we talked about. They ask, how does the final approver know when the investigation is complete?
Sure. So again, when you assign an investigation, that individual who you've assigned it to will receive a task. They're required to populate the incident investigation details. Once they submit that task and complete it, the individual named as the final approver will then receive their own task, indicating that it's now their task to final approve that investigation. In accessing the investigation details, you'll be able to see the response by the investigator, and also, again, you have the option of either accepting that investigation or sending it back for additional investigation.
Perfect. Thank you, Ramo. This next question I'm going to try to answer, but I also invite Ramo to chime in and if he has anything to add. It's asking, from a quality improvement perspective, how can we track retrospectively the different types of incidents encountered within a, I think it means limited time frame. So, and that's a great question. One thing we didn't have time to really show you today, but we'd be happy to show you if you're interested, maybe one-on-one, is the reporting functionality within Compliance Manager. There's a whole module just for reporting. And if you use what we've shown you today appropriately, and you've categorized things and subcategorized them and put them according to risk, a lot of that information you're going to be able to run reports or able to download some of that input into like an Excel type of file, and you can manipulate and massage the data as well. We obviously have the common kinds of reports that people request, and they're very pleasing to the eye. They're metrics. They're things that you could pass on to a board or a compliance committee that you're reporting on the metrics of your program. But as it relates to incidents, there's a way, Ramo, if I remember correctly, to download some of that data, to filter. You'd be able to filter by, if you filled in a category, and let's say HIPAA privacy versus HIPAA security, and you wanted to track or demonstrate that those are going down over time, as long as somebody put that information in, you'd be able to filter and run reports in that way.
Yes, absolutely.
Do you have any comments on that?
Yes, there's quite a robust reporting system in Compliance Manager, as CJ mentioned. There are graphics where you can get some quick sort of data, for instance, what types of incidents are reported, to say something like a pie graph. So you can quickly report that information. You'll also have the ability to get to the detail behind that. Certainly an important thing, showing it at a high level and then the detail behind it as well. And then also you'll be able to export any of that data into Excel to further manipulate it if necessary.
Great, thank you. So here's another question. Somebody's asking, can you elaborate on what you mean by the 60-day ticking clock, or the clock starts ticking in 60 days? I'll be brief because we did a webinar on this as well, and you could look at that. But the reason that I commented on that is, remember from the Affordable Care Act, when it was passed, there was a provision in there that says any identified overpayment, and so this has reference to overpayment, maybe not HIPAA so much, right? It's more maybe a claim. Maybe you did an audit. Maybe my 59 modifier example, right? We identified an overpayment, and we need to return it to the government. And we want to do that, of course. But what the government has done now in the Affordable Care Act is they said, if you don't do it within 60 days, it might be subject to the False Claims Act. A lot of people refer to this as the reverse false claims. What they mean by that is you didn't submit a false claim, you got overpaid. It might not even have been your error. Maybe Medicare or Medicaid or another payer, maybe they overpaid you, it's not your error. But if you've identified it as an overpayment, then you have 60 days to return the funds. And so what I love about Compliance Manager is if you have a very robust prospective auditing or proactive auditing program, a lot of us in healthcare organizations have coders and auditors who are auditing claims, right? And auditing the coding. Well, if they identify an overpayment, that's when the clock starts ticking. And so do you have a system in place to manage those, to know which ones are 3 days away from that 60-day deadline, which ones are 20 days away, and then to prioritize that and to shift your resources to make sure that you're not missing that 60-day repayment period. Now, is it going to be a false claim if you're at day 61? Well, technically, it could be. But in reality, the reason I shared this is the first major settlement on this 60-day repayment issue was announced about a week ago. And it was with an organization called Continuum and some hospitals in New York. And what happened is they identified an overpayment, and they didn't pay it all back within 60 days. It actually took them about 2 years to repay that. And there was some sort of evidence, or at least allegations, that they were trying to cover that up and not have to return that. They were returning the claims that the government brought to their attention, but then they weren't going back and looking at the full universe and returning all of them. Well, it took over 2 years and some pretty significant investigative muscle from the enforcement agencies to get them to return all that. Well, once it was all returned, it was after all that was returned that the whistleblower filed the false claim lawsuit. And they just recently settled for about $3 million. So they had to return the $840,000 of overpayments, but then they got hit with another $3 million because they returned it after the 60 days. So and this is kind of new information. This is kind of an evolving area of compliance enforcement, and this was the first major one that I've seen, at least, that it's been settled, and we have some posts on this actual issue out there too. So that's what I mean by the 60-day clock and why that's an important aspect. Let's see if there are any others. With the ability, here's one, with the ability to select categories, is there any weight to having a naming convention or best practice for the title of the incident? That's a really good question. I'll maybe offer something and see if Ramo has anything as well. But I think you want to keep it, the way I would do it is I would keep it in that it's the same convention that I'm using on my annual work plan. So I would want things to either fall into that annual work plan categories or fall under kind of an other. So what I mean by that is most compliance departments do an annual risk assessment and a work plan, and they'll outline kind of big bucket areas of where they're going to spend their limited resources. HIPAA might be one, billing might be one, anti-kickback statute or Stark might be one. So you get these different big buckets of compliance issues, and I would like to start there. And I would want my naming convention to maybe cover 90% of what I think going to come up, right? Or because I've been doing this for 20 years, it's 90% of what I've known typically comes up. And then I might have some subcategories. So in HIPAA, I might have HIPAA privacy, HIPAA security. So in Compliance Manager, we have some suggested naming conventions, but it also allows you flexibility that if that doesn't meet your needs, you can add some things. Ramo, do you have anything that you want to add on that one?
Actually, you just said it, the flexibility of the system. Again, we provide you with a number of those standards or categories, but you have that flexibility of creating your own, those that are meaningful to you.
Okay, good. Here's another really good example or a question. It's kind of a general question. What qualifies as a reportable incident? So that's a great question. You'll find different philosophies probably out there in the compliance world. I'll tell you mine. If somebody thinks they need to report something, report it. It's so great to be able to demonstrate So one of the other major 7 elements of a compliance program is communication, right? You want to be able to demonstrate that people are aware that they can call your hotline or report an incident, even if it's something that turns out to be silly or not accurate. What you're proving with the reporting of an incident is that somebody's aware of the compliance program, number 1, which, as we all know, is a huge battle in a lot of our organizations. But number 2, they knew who to call or contact. So I tend to err on the side of report it if you feel it's of a concern, because as we demonstrated in the software, you can have an immediate resolution entry, and you can quickly close an incident if you can determine very quickly that it's not one that needs an investigation. What that does is it kind of builds up your population or your volume of incidents to demonstrate, yep, we've got people who are aware. The other thing that's good with that is if you have kind of multiple years worth of that kind of data, you can demonstrate which departments might be more aware. So let's say in 4 years worth of data, 10 incidents from neurology, 4 from medical records, 5 from the surgery department, and never once did I get one from the emergency department. Okay, well maybe that tells me that they don't know about us. Maybe I need to go out. Maybe the physicians are contracted physicians and not employed physicians. So that might be a clue to go out and provide some additional outreach. So over time, as your program matures, if you have all of this in a place where you can store all the data, then what a great tool you have for improving your program over time. I think we're going to do one last question here. And Ramo, this I think goes back to the question you answered earlier about final approver. Mm-hmm. It asks, what if the final approver decides the investigation is incomplete or rejects it?
Right. So again, any investigation can be either approved, or the other option again is to send back for investigation. And you have the option of sending that investigation back to the same individual or perhaps somebody else in the organization. I know clients that have had multiple investigations sort of done, and different employees might do different parts of that investigation. You're able to, or the system will accommodate that as well.
Great. Well, thank you. We couldn't get to all the questions. I'm going to turn it over back to Justin in just one second. If you have questions that weren't answered, feel free to email me, and we'll be glad to reach out. And time back over to Justin.
All right. Well, thanks again, CJ and Ramo, for the great presentation, and thank you to everybody for attending. And yeah, like CJ said, if you do have additional questions, please feel free to direct those directly to CJ at cj.wolf@helpthecity.com. If we weren't able to answer any of your questions or one of your questions during the presentation, we invite you to subscribe to the Help the City blog, where we will be answering these questions from this webinar in upcoming blog posts. We just launched a poll that you should be able to see on your screen now. If you would, please rate how informative this webinar was on a scale of 1 to 5, 5 being the most informative. These polls help us improve our webinars, and we greatly appreciate your feedback. Again, we'll be emailing everyone an on-demand recording of the presentation, as well as a link to download the slide deck. So keep an eye out for that email, and thanks again.